Pire. I lead the water and sanitation team at the UN-Habitat headquarters here in Nairobi. The objective of this online masterclass and the 6-part webinar series that we are launching today is to ensure that the findings and recommendations and the call to action in the UN-Habitat Global Report on Sanitation and Wastewater Management in Cities and Human Settlements, which we launched in 2024, reaches the target audience, starting with policymakers, regulators, service providers, urban development practitioners, researchers, and other sector professionals who may not have the time to read the rich experiences captured in this global report. I would like to first thank the Water and Sanitation for Urban Populations for leading this effort, and also to EWAG, the Swiss Federal Institute of Aquatic Science and Technology, for supporting the development of the masterclass. The next slide, please. So in this inaugural webinar, we will be introducing you to the overall report recommendations and the call to action. We will also be hearing a synthesis of the latest evidence on the public health, environmental, and social impacts of inadequate wastewater and fecal sludge management. We will also learn how cities across the regions are currently performing in wastewater and fecal sludge management, drawing from analysis of primary data that have been provided by authorities in 18 cities across the globe. We will then launch the new UN-Habitat Masterclass to be hosted on our corporate website. Next. So today we have a distinguished list of speakers. Sam Drabble is the Director of Research and Evaluation at Water and Sanitation for Urban Populations. We have Professor Luisa Campos, who is a Professor of Environmental Engineering at the University College of London. And the University College of London was part of the consortium that developed the UN-Habitat Global Report. We have Elise Jabagi, a Senior Water Specialist and Engineer at Aquasalt. Aquasalt was also part of the consortium. And then we have Jude Bianci, Supervisor Sanitation at the Directorate of Public Health and Environment, Kampala, Kampala Capital City Authority in Uganda. Kampala is one of the cities that is captured in the case studies in this global report. And lastly, we have Abhishek Narayan, who is a researcher and project manager at SANDEC, the Department of Sanitation, Water and Solid Waste for Development at EWAG. The next. So we have a very packed program today, and we apologize because this is the first webinar. It will take a little longer than the other 5 webinars in this series, because one, we have to delve into introducing the global report. This will be some trouble. We will then go into a presentation by Professor Luisa on the impacts of inadequate wastewater and fecal sludge treatment, followed by a presentation by Elise on fecal sludge wastewater treatment performance. We will then join an expert panel by Jude, Luisa, and Elise. And then lastly, we will launch the masterclass. So ladies and gentlemen, join me in introducing Sam. Sam, you have 8 minutes. Over to you, Sam.
Great, thank you, Pire. Hi, everyone. So pleasure to have this opportunity to introduce the global report on sanitation and wastewater management in cities and human settlements. Next slide, please. So as introductory context, the first thing to say about this report is it fully aligns with UN Habitat's wider mandate to work towards resilient and sustainable cities, and it aims to provide a global reference on wastewater and fecal sludge management in urban settings. And it has really 3 complementary aims. So to raise political visibility of this issue, this huge issue of inadequate wastewater and fecal sludge management, to inspire by highlighting best fit practice from cities globally, and to provide technical guidance for really the target audiences for this report, which are regional, national, city level decision makers, both working in sanitation and urban development and at the interface between the two. Next slide, please. And we highlight in the report a number of key messages. First of all, we're over halfway through the SDG era, but governments still lack critical data on the status of wastewater and fecal sludge treatment, both globally and at the country level. And urbanization, of course, is intensifying that challenge. Cities struggling to keep pace with rural to urban migration. I'd say really the foundational message of this report, from which much of the analysis follows, is that sanitation is a public good, and sanitation services must be organised into public service systems. And of course, there's a compelling case for that, born partly from the impacts of inadequate wastewater and fecal sludge treatment, which you'll hear more from Louisa shortly. And we set out in the report a structuring framework for citywide inclusive sanitation and what a public service approach to sanitation looks like in practice. And that includes resource planning and management, responsibilities, accountability, underpinned by data management. And we'll hear more on each of these topics as we move through the webinar series. So the report highlights the cost of inaction, aims to provide the rationale for a strong and urgent public response. Next slide, please. And we want to emphasize really the global breadth of this report. So we were able to draw from primary data, as Pire outlined, from 18 cities, primary data on wastewater and fecal sludge treatment from across Africa, Asia, Europe, and Latin America. So including low, middle, and high income cities. And we were able to do that in part because of our consortium partners and the reach that they created. So that included SOAS in Eastern and Southern Africa, TLU in Hanoi, 2IE based in Ouagadougou, as well as UCL Agriconsult, GSMA, and of course UN-Habitat's own networks. So through those networks, we were able to generate that data. We were able to see that many cities in LMICs are struggling to manage wastewater and fecal sludge effectively throughout the sanitation service chain. But there are many cities who are actually confronting this challenge, innovating, driving forward sector reforms. Next. And those are the in-depth case studies that we then look at more closely. And again, we'll hear from each of these cities as we move through this webinar series, beginning with Medellin in Colombia, a really interesting case of long-term planning and financing of citywide wastewater and sanitation services. Ouagadougou in Burkina Faso, where we will look at this really political and fundamental challenge around citywide inclusive sanitation, which is how to extend services to informal settlements. Dhaka in Bangladesh is a fascinating mega city context where we'll hear about regulatory reforms that are being driven forward and how authorities are engaging with a particular challenge around widespread direct discharge of septic tanks into open drains. We'll look at data management in Nakuru in Kenya, where a new tool is being piloted to enhance data management and inform sanitation investment planning. And finally, Hanoi in Vietnam. The final section of this report is focused primarily on climate resilience and innovations in that area. There's a really interesting case in Hanoi around sustainable urban drainage systems and implementing climate resilient wastewater management. Next. So we take that primary data from the 18 cities, those 5 in-depth case studies, and we synthesize that to arrive at 6 core recommendations which provide the basis for the call to action in this report. So very briefly, and you'll hear more in each of these areas, cities need to invest more, but invest more smartly with specific attention to the environmental context. Wastewater and fecal sludge management services must be integrated with national and local urban policies. We look closely in this report at that interface between sanitation and urban development. Roles and responsibilities must be clear across the sanitation service chain, sewered and on site. We make the case for greater resource allocation to regulation. We know regulation is a critical enabler of improved services at scale, but it is generally under-resourced and that needs to change. National monitoring systems need to improve radically. We need to support countries in developing credible public data systems, and cities need to adopt measures for safe, emphasis on safe wastewater and fecal sludge valorization. So we look at reuse, and that can be, of course, a really powerful enabler of circular economy approaches, but it needs to be done in a way that is aligned with public health goals. So we'll come back to each of those recommendations in due course, but that's all for this overview. Back to Pire for the first poll.
Thank you very much, Sam, for summarizing a 168-page global report in less than 8 minutes. You have saved us 2 more minutes. We will be sharing a QR code to access the full report at the end of this session. So you are welcome to join us in this poll question, and this will take only 20 seconds. So please go through it and answer your questions. We will then be summarizing the results. So the first question is: sanitation should be treated as a public good because it cannot be privatized or managed through market mechanisms. It benefits society as a whole. It improves public health. Everyone automatically gets access regardless of investment or policies. It improves economic productivity. It improves environmental protection. Sanitation should be treated as a public good because. So let's wait for the results. Can we show the results? Some of the participants are saying they're not able to vote in the poll. There's a link there that has been shared. Has anyone been able to vote? Many people are saying they're not able to vote. Oh yeah, so many people also have voted. Oh yeah, many people have voted. Okay. So can we show the results, please? Otherwise, we go to the next presenter. We can show the results later. Is it okay that way?
Yep. I think Pire we'll look into this to see if we can show the results later. I think let's move on for now.
Yeah. Thank you very much. So the next presenter is Professor Luisa Campos. She will be presenting on the impacts of poor sanitation and wastewater management. Prof, you have 10 minutes.
Thank you so much, Pire. First of all, I would like to thank the organizers for inviting me to present part of the literature review conducted by our UCL team, including my colleague, Professor Priti Parikh, our former student, Kushma Tapa, and myself. I will be very brief in my presentation, so I encourage you to download the report. Next, please. To illustrate the impacts of poorly managed sanitation and wastewater, we adapted Ray Vart's economic model, the figure on the right, highlighting the need to stay within an environmental ceiling shown in the outer blue ring and a social foundation shown in the inner blue ring here. The goal is to achieve a circular economy for sanitation, which is shown in the gray ring, which is both ecologically safe and socially just. And the impacts are shown in the red areas. Next, please. To illustrate the sources of pollution, we create this diagram, which shows wastewater flows from two main sources: point source pollution, such as direct discharges from pipes linked to homes or industries, and non-point source pollution, such as farm runoff or urban stormwater, which spreads pollutants, including pesticides, oil, chemicals, and microplastics across wider areas. Next, please. The first impact we examined was health. We have confirmed that inadequate sanitation creates major health risks, causing 1.6 million deaths a year, with children and vulnerable groups most affected. Also, 1 in 4 children face stunting from repeated infections, and women and girls suffer greatly in terms of dignity, safety, and maternal health. Next. We also found that beyond infection disease, less visible health risks include serious dangers for sanitation workers who face exposure to toxic gases and infections. Wastewater chemicals such as nitrates, endocrine disrupting chemicals, EDCs, per and polyfluoroalkyl substance, PFAS, known as forever compounds, and microplastics can harm human health, while unsafe reuse in agriculture increases risks of foodborne illness and skin disease. We highlight here that wastewater reuse in agriculture is promising, but without regulation, it can be dangerous. Next, please. Then we examine the environmental impacts. Inadequate sanitation causes widespread environmental damage, polluting water, degrading coral reefs, and harming biodiversity. Wastewater toxins also affect the soil and wildlife, with up to 58% of coral reefs exposed to sewage nitrogen, threatening ecosystems and the entire food chain. Next. Next, we examine the impacts of climate change. Wastewater management is not only a health and environmental issue, it is also a major climate concern, contributing over half of water sector greenhouse emissions, gas emissions, and over 500 million tons of CO2 equivalent annually. This is largely from inefficient treatment and on-site systems. Next. Then we examined the core economic impacts of poor sanitation. We found that poor sanitation comes at an enormous economic cost, exceeding $182 billion globally, with up to 3.2% of GDP lost in some low and middle income countries. It also results in $16.5 billion lost annually from illness and missed work days. Next. In examining the broader socioeconomic impacts, we found that poor sanitation significantly affects quality of life, especially for women, girls, and vulnerable groups who face greater risks around safety, hygiene, and dignity. Tools like sanitation-related quality of life, SANQOL framework, shown here on right, help measure these impacts through user perceptions, highlighting improvements after interventions like public toilet construction. In this example here, the red line represents pre-intervention and green line represents post-intervention, in this case, after construction of public toilets. Next. We will also explore the benefits of improved sanitation. Improved sanitation delivers multi-sector benefits, reducing child stunting, cutting greenhouse gas emissions, and boosting the economy by up to $1.6 trillion annually through better health and productivity. It also significantly enhances quality of life, especially for women and girls. Next. In conclusion, poor sanitation and wastewater management drive major health risks, ecosystems damage, and water pollution, leading to widespread disease and degraded environments. These combined impacts place a significant burden on economies through lost work days, healthcare costs, and also reduced productivity. Thank you so much.
Thank you very much, Professor Luisa. You are right on time. Participants are encouraged to post any questions that you may have in the chat. We will address some of the questions at the end of this session, but we also have, the speakers standing by to answer them directly in the chat. So let's go to the second poll. Yes, so the second poll is, what are the key environmental and socioeconomic consequences of poor waste management? And you have multiple choices. You can choose more than one. Eutrophication caused by nutrient pollution can create oxygen-depleted dead zones in water bodies. Poor sanitation increases methane and carbon dioxide emissions, contributing to climate change. Economic losses from poor sanitation exceed US $200 billion annually. Industrial wastewater always undergoes full treatment before being released into the environment. Sanitation has low impact on gender equality and social inclusion. Biodiversity loss due to wastewater pollution is limited to aquatic ecosystems. Wastewater treatment can reduce greenhouse gas emissions if properly managed. Coastal tourism is unaffected by poor wastewater management. And lastly, poor sanitation affects property values, fisheries, and other economic sectors. I hope that a significant number of participants are now able to vote. We are monitoring the charts to see if we still have problems. You kindly alert me if we are able to show results, or we can move on. I will be coming back to the poll questions and their answers later on if we are not able to show them immediately. Just alert me if you want me to continue or wait for the results. Otherwise, we go to the next presenter. Great. I think we will come back to the poll questions later. Let us introduce Elisa Jabagi. Elisa Jabagi is the senior wash consultant at Agro Consult, one of the consortium members that also contributed to the global report. Over to you, Elisa. You have 10 minutes.
Yeah, thank you so much, Pire, and I'll try to be quick. So good morning, good afternoon, everyone. I will be talking in this short presentation on the performance of wastewater and fecal sludge management, and it is based on the UN-Habitat report. And as Sam mentioned, it is based on the on data from the 18 cities. Next slide, please. So we looked at both wastewater and fecal sludge management. And I know most of you know that, but just for a refresher, a wastewater is collected through a sewer or a pipe network and reaches almost all of the time a centralized treatment unit. For on-site sanitation, there are fecal sludge that are contained within, for example, septic tanks or pit latrines, and they have a separate transport and treatment. But understanding both sanitation chains and understanding the challenges across both will help us improve and make these services more resilient and more sustainable. Next slide, please. Now, just for context, almost 2/3 of the population rely on sewer network, but this coverage is not it's not even, because if you look at those 18 cities and you look at the graph, you could see that most sewer system is within the high income countries. So for example, Paris, Hamburg, or Sofia. And on the other hand, the on-site sanitation is mainly in sub-Saharan Africa and South Asia, where they mostly rely on this system. So for example, if you look at Mali, at Togo, at Nepal, or even at Burkina Faso, they're highly reliant on on-site sanitation. Now, while 2/3 of the urban population is relying on sewer network, the on-site sanitation system is growing faster than sewers in many regions. And the urban growth and urbanization is outpacing the sewer expansion. So it's very important to also focus on on-site sanitation in researches and in reports, and especially because there is a recent focus on citywide inclusive sanitation that combines both sewer network and safely managed on-site sanitation. Next slide, please. So to understand the performance of wastewater and fecal sludge management across the sanitation service chain, we had to also understand the data behind it and how reliable is the data. So when we looked at the wastewater, we saw that the data is somehow inefficient or limited, especially because at national level, the reporting systems are somehow outdated, or there is a lot of regions that don't report or report in incomplete or unreliable figures. But we have some estimates that could be derived from monitoring tools like the SDG 6.3.1. We also can calculate based on scientific models and proxies. And in the report, the latest figures that we showed are 50% of the wastewater collected is being treated. Now, for fecal sludge, the situation is a bit more challenging because we don't have until today an aggregate estimate of fecal sludge, because the situation is a bit different because of the informal and fragmentation system nature of the fecal sludge. And that's because the desludging frequency and quantities are often not documented, and the characteristic of the sludge at the city level is also lagging. But just to say that we are facing all of these challenges, there are models that exist that could quantify the flow in the city at the city level, quantify the wastewater and the fecal sludge flow based on proxies and assumptions, but they could give us a visual picture, which is what you're seeing on the slide here as the shit flow diagram. Next slide, please. Then, if we want to also understand the performance, we need to understand collection and conveyance. For wastewater, we saw that most of the cities, and again, as you can see from the graph, they rely on combined sewer network, which means wastewater plus stormwater. In the 19th century, it was an innovation and it did solve a lot of challenges, but recently it's struggling, especially based on an increased urbanization and the increased impact of climate change. Now, some cities, and of course the cities that can afford it and have the resources, are upgrading the systems with flow separation, green infrastructure, and smart sewers. For fecal sludge, we saw the containment to be pit latrines and septic tanks most commonly in low-income areas, but we also saw that often there are poor construction, which leads to leaks, pollutions, and sometimes failures, and they're highly vulnerable to climate change. And the sludge also is not regularly emptied. It's more a reactive emptying rather than a proactive or preventative emptying, which could lead to overflow and pollution. And we also saw that there is a shift toward formalized emptying services, but the regulation and the oversight remains weak, which offers the opportunity for informal dumping of waste in the environment. Next slide, please. Now, finally, for the treatment performance, the numbers that you're seeing on the screen here are mainly from wastewater treatment plants, just because when we were looking at fecal sludge treatment plants, the data that we received from there was a bit unreliable and insufficient for us to make final conclusions. And because what was really surprising is that in most cities, even the cities that have on-site sanitation, didn't had more wastewater treatment plants that are not operating or operating at very minor capacity than focusing on constructing fecal sludge management treatment plant. And often what we saw is that fecal sludge will be transferred to those wastewater plants and be treated with the wastewater. Now, if you look at the data, you can see that high-income countries achieve higher treatment performance, which is basically achieving the tertiary treatment, which is somehow a very high treatment standard. And the low-income countries, on the other hand, do reach secondary treatment, which is the minimum treatment for public health, but sometimes fall short. So, for example, if you look at Dhaka and Bandung, you see that they are lower than the secondary treatment. But when we dig deeper within the data, we realized that Dhaka and Bandung wastewater treatment plant were receiving fecal sludge in their flow, and that's why the performance was lower than the other cities. Now, just to say that high-income countries are rely more heavily on advanced biological and mechanical technologies, which are resource-intensive and are energy-intensive and emit a lot of greenhouse gas, but they have higher treatment performance. And when you look at low-income countries, they rely mainly on nature-based solutions. And although these are cost-efficient, they don't generate greenhouse gas as much, and they don't require as much energy, but they are very prone to external factors which could impact the treatment performance. And just for context, for technical context, here we looked at 3 indicators for the treatment performance: the BOD, which is the biological oxygen demand, which shows the organic pollution; the TN and the TP, so the total nitrogen and the total phosphorus, which shows the nutrient pollutions. And this is why you're seeing these figures on the screen. But again, as Louisa said, I do encourage people to read the report because that was just a quick snapshot of one of the chapters on the performance. And just in summary, although we saw a lot of progress happening across both sanitation service chain, we still see challenges, especially on the technology level and with the outdated infrastructure, at the informal service delivery models, and within the regulation and monitoring systems. Thank you so much. Back to you, Pire.
Thank you very much, Elise, for this very insightful presentation on the treatment performance, a very important aspect of sanitation and wastewater management. We now have the final poll. Don't worry about the results showing on the screen. We will find time to go through all the answers for the 3 polls. So this is the final poll question. While wastewater and fecal sludge have different characteristics and thus require different treatment technologies and solutions, predicting volumes and characteristics, quantities and qualities, Q and Q, is almost identical. Is it true or false? While wastewater and fecal sludge treatment have different characteristics and thus require different treatment technologies and solutions, predicting volumes and characteristics is almost identical. True or false? And because we will be looking at the results at the end, let us go to the expert panel now so that we save some time for Q&A at the end. We can look at some of these issues at the end. Am I rushing the poll question?
Go ahead, Pierre. Thank you.
No, thank you very much. So we are now joined by one person who has not spoken, and that is Jude from Kampala. Jude will join Luisa and Elisa in this conversation. So I will have the first question for Jude. And Jude, because you have not spoken, you have 4 minutes to respond. So this is the question. The global mapping in this global report shows that there is misalignment in many cities between the predominance of on-site sanitation and the low availability of treatment facilities capable of treating fecal sludge. For example, Kampala is one of the only 4 cities in our sample with a dedicated fecal sludge treatment plant. Can you talk us through the steps that the Kampala City Authority has taken to increase the proportion of sludge, of safely managed sludge at the city level?
Okay, thank you very much. Hello, dear. Thank you very much for that question. Just to give a background of Kampala, in 2010, over 90% of the population in our city were dependent on on-site sanitation facilities. And unfortunately, 45% of the facilities were being abandoned after use of in 2 years. This led to having our communities having a lot of fecal sludge, which is not taken to the treatment plant. And hence that led us to make a decision of coming up with the treatment plants specialized for fecal sludge. The steps we took, after realizing that, then we had the putting up of constructing the LBG treatment plant, having a specialized component that can treat 400 cubic meters per day. And this was realized in 2014. Then the next thing was we decided as a team that we had to promote sanitation as a business in order to be able to collect waste, fecal sludge from the communities and it's taken to the treatment plant. So the first thing we had to do was to bring on board all actors to form the Kampala Water and Sanitation Forum and also to agree on a common goal. After having that common goal, then we went and did a market survey for fecal sludge management in our city with a goal of promoting sanitation as a business. Then we found out that our people who are collecting the fecal sludge did not have enough capacity. And so we had to build the capacity of those companies that were doing the collection, which were different from government. Then we created demand. The demand creation was made through making a survey. And then after we realized what we could do to make sure that sanitation could thrive well as a business in our city. So we had to come up with a campaign, the Weyonje campaign in our city. Also, we put up a toll-free line whereby people who wanted the service would call the municipality and we connect them to the service providers. We did the community pit emptying, whereby you go to a community and you demand everybody who has a full pit to be emptied at a subsidized fee. Then also we promoted technologies that would reach everywhere, including informal settlements, which were not accessible to the trucks. Then we made sure that for the business to thrive in our city, we created a new law, that is the Wastewater and Fecal Sludge Management Ordinance in our city of 2019. After doing all this, we found that it was difficult for us to continue until when we had to come up with the Kampala Fecal Sludge financing strategy for our city. The key challenges we have faced is mainly the technologies which we have in our city. Because of the varying characteristics of fecal sludge, we find ourselves that the current technologies have to be improved in order to handle the fecal sludge which is having the varying characteristics. Also, we have the problem of solid waste in the pits. That one makes the current technologies not work to empty our pits. Those are some of the challenges we are having. Thank you very much.
Thank you very much, Jude, for that comprehensive answer on the experience in Kampala. Now, let's go to Elise. There is the global mapping also includes cities in high-income countries with 100% seaward coverage, such as Paris, Hamburg, and Sofia. What does the analysis tell us about how these cities are currently performing in wastewater treatment and the challenges they're engaged in?
Yeah, thank you so much, Pire. Yes, we saw in the report that high-income cities' sanitation systems are generally more advanced, but there's always a need for ongoing effort and adaptation. So they achieve high treatment performance and go beyond removing only organic pollution to also removing nutrients and some of the emerging pollution. And some are experimenting with these technology, for example, that can reduce micropollutant, but and also there is a push towards resource recovery, so reusing treated water and converting sludge to energy. But still, even in these well-resourced systems, they still face challenges. So one of the challenges is an aging or outdated infrastructure, and the upgrading of these is expensive, disruptive, and slow. Climate stress is also a growing concern, so flooding and drought, among other climate risks, are increasing, and there's a need to adapt or even transform to become more resilient, and this has also required additional resources. Another issue is the energy use. So as I said in my presentation, wastewater treatment is energy intensive, and cities are under the pressure to reduce emissions and operate more sustainably. So that creates a bit of a tension between improving the performance, but also managing the climate targets. And on top of that, of course, the emerging contaminants, pharmaceutical, microplastic, and so on, and they're raising new regulatory questions. So most of the existing system, even in high-income countries, are not equipped to deal with these pollutants. And retrofitting or transforming these plants to address these can be costly and also technically challenging. So just in a nutshell, or in short, these cities are achieving the maximum that is being achieved right now, but it's a reminder that nothing is static, and there should always be adaptation to the current situation, but also resilience to the uncertainty of the future.
Well, thank you very much, Elise. And I think the big message here is that having 100% sewerage coverage, doesn't mean that you do not have challenges that you're dealing with, in wastewater management. Lastly, let's go to Professor Luisa. You have wide-ranging experience in the water and sanitation sector with UCL, but also working over 10 years as a state water and wastewater company in Brazil. The impacts of inadequate wastewater and fecal sludge treatment you have presented are clear, but in your experience, what are the most effective ways to now communicate this evidence to decision makers to influence investments in sanitation?
Thank you so much for your question. Well, in my experience, the most effective way to communicate the impacts of inadequate sanitation to decision makers is to translate the technical evidence into clear, context-specific messages that highlight health, economic, and environmental consequence, and also the cost of inaction. In my experience, also visual tools is also excellent. Visual tools such as risk maps or cost-benefit models can be also powerful, particularly when they show links to public health burdens or economic losses due to untreated wastewater. But I also believe that engaging with local champions or using real case studies and also aligning messages with political priorities, such as SDG targets or climate adaptation plans, they have proven particularly effective in various African countries, for example. I cite here sheet flow diagrams that they have been used in many African cities, such as Nairobi, to raise awareness of stakeholders, including policymakers. Also, I cite another tool, SaniPath, that is exposure assessment tool, has been applied to Accra in Ghana. And also would like to cite our work led by my colleague Priti Parikh on the interlinkages of sanitation and sustainable development goals. It has been excellent. We worked in Brazil, now we are working with South Africa, and our goal is exactly translating our findings into a visual that will, provoke that image that the stakeholder or the policymakers will buy the idea that the importance of sanitation, the benefit of sanitation in everything, because we have found that sanitation has linkages with 130 targets out of the 169 targets of the SDGs. So anyway, I think that visual tools is very promising to pass the message. Thank you.
Thank you very much, Prof. So we now have only 13 minutes left, but I want to take the first 6 minutes to now launch the masterclass, and that will be done by Abhishek. I think I had introduced Abhishek before. So over to you, Abhishek. 6 minutes.
Yes. Thank you so much, Pire, and thanks everyone for joining. I'm really excited to be part of this launch because I think the global report on sanitation and wastewater management from UN-Habitat is really a first of its kind, focusing specifically on urban sanitation issues, both from a technical but also from a financial and regulatory perspective. And I also want to appreciate UN-Habitat's vision in ensuring the translation of such a technical report into a more engaging format that will reach a wider audience. So therefore, we're really, really proud to be part of this initiative. And the next slide, please. So why are we calling this a masterclass? Just to clarify. So unlike a traditional an online course or traditional learning, this is much more focused on a very specific topic, and it's much shorter and sort of an intense synthesis of the great work that the authors have done by mapping these 18 cities, but also having some of the foundational concepts in it. And it's really expert-led. So that's one of the reasons why we didn't just call it an online course, but called it a masterclass. And what is inside is basically 7 videos that summarize some of these key messages, but also we've ensured that some of the most important conceptual explanations are also part of this video series. And as I already mentioned, the videos are shot with experts on each of these different topics and has some of the state-of-the-art visuals to provide clarity on these concepts. And it really follows the same trajectory as the masterclass structure and uses a lot of the content from the global report as the main anchor for the masterclass. Next slide, please. So to just give you a quick overview, so these 7 videos, the first one begins with an introduction, clarifying the goals, what you can expect in the masterclass, and then we move on to, in the second video, on the interlinkages between sanitation and urban development, and talking about the economic and other reasons as to why sanitation is important, and then going into the impacts of poor sanitation, again, from a health, economic, and those perspectives, and then following on to the wastewater and FSM performance globally, seeing how things are at the moment, and then moving on to the responsibilities and resource planning aspects of sanitation, and then accountability mechanisms. How can we leverage data and digitalization to improve the state of affairs? And finally, we close with innovations in terms of climate, epidemiology, some of the more advanced treatment options that we have in place, and then summarizing all of this into the 6 key messages that we already heard today, but providing them with a bit more emphasis on the content that was already shared in the other videos, and providing the 2 cross-cutting enabling environment factors as well. So that's really the package. So these 7 videos come in just over an hour. So within an hour, you'll be able to complete all 7 videos and get a really in-depth understanding of the topic. So this was, of course, developed by Airwag and WhatsApp. And I also want to give a shout out for our partners, One Water, who had supported us with a lot of the visuals and other interesting animations that you would see in the masterclass. And finally, also want to share the QR codes to access this masterclass. And it's important to clarify that the masterclass is very complementary to the webinar series. The masterclass will focus more on the first principles, the basic concepts, and overarching messages, whereas the webinar series will go in depth into each of these topics with the case studies from the 18 different cities. So that's why we've ensured that the structure of the masterclass and the webinar series are parallel to each other and really complementary as well. So the link here for the masterclass will take you to a YouTube channel of UN-Habitat Learn, where we've uploaded all 7 videos with some explanation, and the report, of course, takes you to the PDF download within the UN-Habitat page. It's important to also clarify that we felt YouTube is one of the easiest ways in which people can access. All the courses here are free and open access for anyone to watch at any time in your comfort. And I think that way it has really sort of democratized the content in a way, because you have captions also that is auto-generated. So I think with that, I hope everybody is able to access the masterclass. We are always welcoming feedback from you if there is anything that you note based on the masterclass content. So thank you very much, and back to you, Pire.
Thank you very much, Abhishek. And with those few remarks, the masterclass is now officially launched. I would like to encourage the speakers and the panelists to check on the charts, because there are certain questions that are specific to your areas of presentation. You can decide to answer them directly, or if we have a few more minutes, we can also open up the floor. We have 2 hands up, and I think we can give the 2 hands an opportunity to interact with the speakers. Now, I'm not able to see their names, so please help me get them to speak. Are we able to open up the mics for them to speak? I was told this is possible.
Koki, please, you have to unmute yourself.
Mm-hmm. Over to you. We have only 6 minutes left. You can go to the next speaker. So I think if that is not possible, then I wanted us to revisit the poll questions in a few minutes before we close, because these were very interesting questions. And we promise that in our next webinar, we will be able to show the results on the screen as we go. So the first question was on sanitation. The answer is that while sanitation must be considered as a public good that is essential for ensuring public health, this does not mean that certain aspects can and should involve private sector involvement, especially fecal sludge emptying. Being a public good does not translate to automatic and free access to sanitation services. It also does not mean that it does mean that special provisions such as targeted subsidies or lower fees and tariffs for the urban poor should be enabled. It does mean that special provisions such as targeted subsidies or lower fees and tariffs for the urban poor should be enabled. The second question on the key environmental and socioeconomic consequences of poor waste management. Yeah. So the correct answers if you can project the second one, the correct answers are A, that eutrophication caused by nutrient pollution can create oxygen-depleted dead zones in water bodies. That's a correct answer. The next one is B, that poor sanitation increases methane and carbon dioxide emissions, contributing to climate change. The next correct action is C, economic losses from poor sanitation exceed $200 billion annually. The next correct answer is G, wastewater treatment can reduce greenhouse gas emissions if properly managed. And lastly, I, which is poor sanitation affects property values, fisheries, and other economic sectors. The last poll question was on the either true or false. While wastewater and fecal sludge have different characteristics and thus require different treatment technologies and solutions, predicting volumes and characteristics and quantities and qualities is almost identical. So the answer is false. It is much more difficult to predict volumes and characteristics of fecal sludge, as fecal sludge is stored underground in containments that are often informally or self-constructed without any records or level of standardization. Understanding quality and quantity of wastewater and fecal sludge that is generated in a city is paramount for designing appropriate management strategies. So, ladies and gentlemen, in the next 2 minutes, allow me to conclude. And I want to now put the focus on our second webinar. If you please project the webinar, yes. So our second webinar is coming up on the 22nd of May, and this date is confirmed. The focus of that webinar will be on Chapter 5 of our global report on resource planning and management, where we will be putting emphasis on the long-term investment planning that is based on sound economic assessments as the starting point. We'll be dealing with issues around cost recovery in sanitation and wastewater, issues around tariff setting, budgetary allocation by national governments, the role of the private sector, and the changing face of ODA and its implications for management of sanitation and wastewater. So please book that date and let us join the webinar on Thursday, 22nd May. Let me take this opportunity to thank all our speakers today for a work well done, and also to thank the Gates Foundation for supporting financially the development of this global report and also the development of this masterclass. You are welcome to get into the details of the master plan, the master class on our website, and also we have shared the links to the two also on the chat. So you're welcome to join, and also join us in our next webinar. Thank you very much for finding time. We are right on time, and thank you very much for finding time to join us today. Bye.
Bye-bye.